Hello, I'm Dr. Inman. I'm this frequency-specific low-level laser guy. I'm the one that basically has developed over 1,800 different protocols for this instrument, and I've used other instruments before in the last 20 years. We've clinically derived applications and protocols for treating a number of different disease conditions. There are thousands of them: dog, cat, horse, and human. The condition I'd like to talk about today is one that's very common: gastroesophageal reflux disease, or gastritis associated with incorrect digestion and movement of food through the stomach, increased gastric acid, etc., etc. The frequencies that we use for gastritis and gastroesophageal reflux disease are actually in this device, and they contain a number of different frequencies that address this condition specifically. Essentially, this is the Prilosec disease. People basically take Prilosec for the rest of their life because they have heartburn or gastritis, gastroesophageal reflux disease. It'll cause them to have discharge and common nasopharyngeal discharge, and a number of other maladies associated with this condition. It becomes worse sometimes at night, and they can have, excuse me, maybe I have it. They can have heartburn so severe that they have to wake up in the night and take antacids, essentially. This is a condition where the Prilosec, which is a H1 blocker, basically stops the production of gastric acid, which gives relief. However, you take it all the time. That doesn't fix the problem. The problem is unbalanced autonomic nervous system. The gastritis occurs because there's an unbalance of the sympathetic and parasympathetic nervous system. And so when we treat gastritis, we're going to treat the stomach, we're going to treat those cells, the parietal cells that are creating the gastric acid, and put them back to normal. But also we're going to increase the blood supply, increase the venous drainage and lymphatic drainage in this particular case. And also, even more important, is we're going to overstimulate the sympathetic nervous system, which is elevated. Now, we've talked about this in other seminars before. The sympathetic is low, the parasympathetic is high. This is normal. However, in a case of chronic inflammation, essentially, of the body, as the person ages, essentially, that sympathetic level gets higher and higher. Stress, which decreases the parasympathetic level. Once it gets down to about this level, essentially, where they're even, what you end up with is elevated sympathetic tonus, and that basically produces a decreased parasympathetic tonus, and it's like the car running in first gear all the time. It basically doesn't function very well. And so our goal is to reestablish this, and we do that in kind of a backhanded way, since the sympathetic is basically controls the parasympathetic. The parasympathetic, which you want high, is a slave to the sympathetic, flight or fight mechanism. Okay, so what we do is we overstimulate the sympathetic nervous system, which causes it to go even higher, and once it gets after about 28 to 34 seconds, it will basically just say, well, I'm not going to deal with that anymore, and resets back to the normal level, back to its inherent low level. And so it's called a sympathetic overstimulation. It's incredibly powerful, and it's one of the ways that we take care of this disease condition. This disease condition is an unbalance of the autonomic nervous system. So our gastritis and a gastroesophageal reflux disease, and the protocols that we have, there are 3 of them in this particular instrument, are set, and they all carry the frequencies for the human being that overstimulate the sympathetic nervous system and reestablish the parasympathetic. And in 2 of the 3, essentially, there's also a parasympathetic stimulator, which will also optimize the parasympathetic. And what that does is it puts the GI tract back to normal again, allows itself to heal. This can also be something that we use for gastric ulcers, duodenal ulcers, essentially, and other conditions of the stomach and the duodenum, essentially. Also for pylorospasm, and there's also a protocol here for for volvulus, which is gastric torsion that we see in the canine, which can kill them. And so the protocol is such that we're basically treating the area in the thoracolumbar area from T1 to L3, essentially, which is the vagosympathetic nerve, is a sympathetic nerve area, essentially the area of the sympathetic nerve system, which is from here to here. We also, of course, getting the stomach and those tissues, and we just basically do this for 60 seconds. The client very commonly will achieve, if we do it twice in the first day, an hour apart, will probably achieve benefit that evening without medication, without the Prilosec, essentially. And over a period of laserings, twice a day for 3 days, once a day for 3 days, twice a week for 2 weeks, essentially, we can essentially resolve this problem. Now, 8 months down the road, it may come back, and we may have to laser them a couple more times to remind the body what it's supposed to be doing. But There's a number of other disease conditions that occur because of this unbalanced autonomic nervous system. So we're not only treating this condition, but also other potential conditions which are subclinical, such as compromised kidney function, liver function, pancreatic function, and predilection to diabetes type 2. Okay, so anyway, that's another lecture altogether. Anyway, this is how we treat gastric esophageal reflux disease in the human being, and it can be particularly effective, keep us away from having to take Prilosec for the rest of our natural life. Thank you very much for your attention. I appreciate it. And if you have any questions about this application, please contact me at drbill@vomtech.com. That's DRBILL at VOMTECH.com, or contact me via phone at area code 208-640-3430. That's 208-640-3430. Thank you, and have a super day.